number one, effectively communicate exactly what the machine is doing. You know,
Yep.
I'm getting lost in the right now. I need a script or something to work off that I can take ownership of and change, you know, as I need to be. Number
Yep.
one. Protocols, you know, I'm just saying, put it over a spot that hurts and sit there for another 13 minutes, you know. I'm sure there's a little bit more, so that has to be addressed. And the third one is I have a lot of people with autoimmune diseases, a lot of Lyme disease patients and things like that. So whatever protocols we have for that sort of individual, I'd love to hear.
Yep.
You know, and then if we could cover some of the contraindications, you know, cancer, you know, of course, electrical implants, all that sort of stuff, what it can and can't be used for. Can I use it on a cancer patient, just not over the site of activity, or do I just not use it at all? You know, that sort of stuff. Or is it just fine to use it? And let's see, there was one other thing that just blew through my mind in a hurry. It'll come back to me.
My guess is we're going to address it with the questions you've already asked, because you asked these are fantastic questions. These are critical key questions that essentially, even though they're not connected, they're all connected once we start talking about the machine. So all these questions we're going to break down in great detail, and you should walk away with a really good understanding. And the reason that we're going to record this also, that we're recording this whole thing, is that way we can move a little bit quick without having to stop for notes, because you're going to have this video and this audio forever. You'll have, you know, a year from now, if you're like, hey, what did we talk about on this thing? You can scroll back the video and bring back our conversation, which I found just to be so helpful.
Here's a question that dropped out.
Yeah.
So basically, I had one gentleman come in last week. I put him on the machine, and he's, you know, sort of a finicky character, always aching and complaining. I've been treating him for many, many years. He came back. He said, I've been achy all week. Is it the machine?
Yeah.
And I said,
yeah.
I don't know. I don't know if that's a good sign. I mean, in my practice, you know, I try to reframe things like, okay, you have some aches and pains, and that's a good thing because, you know, you reframe me in as the body changed. I don't know enough. This machine, yes or no. So that's kind of where I'm at.
Yep. I wish you were sitting next to me, because I have this big grin on my face, because these are the best questions. You guys are past the 101 questions, like how do you plug it in and turn it on. We spend a lot of time doing that as opposed to covering this stuff, which is the key stuff. So I'm thrilled, because this is good stuff. Once we address it, it's gonna bring you a greater understanding of what the technology is doing and what it can do. You hit a hot spot when you said autoimmune. We get awesome results with all autoimmune when most other technologies and modalities don't. So this is going to be a good dialogue, I think, for us, because obviously you're going to see a fair amount of patients like that. Okay, so I'm going to jump right into the very basic core of what is this thing? What is PEMF therapy? Okay, I'm going to give you a very simple answer that we communicate to the patient, and then I'm going to talk a little bit about the science of it so that you have a greater understanding. And again, I go into these assuming, if you will, in quotes, nobody knows nothing. So if I'm telling you stuff you already know, you can say, yeah, I got that, I know that. You know, if I'm repeating stuff you already know, I'm just giving the basics so there's a general understanding, okay? PEMF therapy, what we use, okay, because if you Google PEMF therapy, you're going to get 1,000 Google pages of all these technologies. In our world, our high voltage PEMF therapy device, what it does is it is induction of electricity into the cells to stimulate healing. At the core, that's what our machine is doing. We are inducing electricity. Why is that important? Because of the safety factor. STIM, TENS, ultrasound, laser, every other modality that is in your office is a higher risk modality than ours. And the reason being is it directly puts current, energy, voltage from the wall into the user. There's no in-between. With induction, we are creating electricity at a distance. That is why you take the loop, you put it a foot away from your belly, and your tummy jiggles. And you go, oh, that's funny, my belly's jiggling, and I'm not even touching my stomach. We are creating electricity at a distance. It is a big, big safety mechanism, and it allows two things. It allows us to use a huge amount of power, okay, and it allows us to treat areas of the body much longer than most other modalities. Just going back to an old school modality, pulsed diathermy, shortwave diathermy, right? We're creating heat inside of the body to reduce inflammation. If you use that modality too long, you will burn or injure a patient. We're the polar opposite. We are literally on and off like a micro switch, okay? And how that equates to a very simple understanding to the patient of, well, what does this thing do, doc? This is a battery charger for your cells. That's what this machine is. Every cell is like a little battery in our body. It has its own ability to release a charge and to store a charge. Whenever we have injury or illness into the body, we can measure that the voltage at the cellular level has reduced. Our machine passes a very strong but quick magnetic field through the cell, and with each pulse, the cell retains a charge. There's a net energy gain. It's like filling up a cup of water. Okay? And when the cells are full of energy, they say, wait a minute, I'm not a post-operative knee ligament cell. I shouldn't be producing scar tissue. I'm a healthy cell, and they produce the right type of tissue. Or I'm not fourth stage pancreatic cancer cell. I shouldn't just be replicating myself over and over. I should be doing these functions. And they go back to their normal function. Okay? I auditioned for a TV show with this machine about 5 years ago, and after I did all this talking, they said, okay, you can only say about 3 more words because you don't have time on television. So they said, what is this thing really? So I sat there and I said, it's homeostasis. And that is what this machine is in one word for you. Okay, we're going to expand on all that, but it is really homeostasis at the cellular level. We get fantastic results with hypothyroid, and we get fantastic results with hyperthyroid. Low blood pressure and high blood pressure respond. Okay, it is at the cellular and subcellular level, putting the body back in balance. Okay, as we go through this presentation, okay, and I'm going to be sending this to you, it talks about some of the indications, and when I say indications, the FDA 510Ks, the known medical approvals of PEMF therapy, and there's a bunch of them, so you can go through and you can talk to the patients about fractures or swelling or muscle stimulation, nerve regeneration. There's a lot of approvals, okay? But really the important thing that we talk about are the known scientific attributes, what we know scientifically this machine does, right? Especially with other types of therapy. You can Google it, and it'll say, well, it sort of does this, or it sort of does that, or we have a double-blind clinical trial from the Guam University of Medicine with cancer, and that's not accepted in Western medicine. So we stay away from all that because of the scrutiny, and I only talk about the known science. Once you have the known science in your hand as the practitioner, it's pretty easy to connect 1 + 1 + 1 = 3. Does that make sense?
Yes.
Okay, so let me just go over the known attributes of the pulsed field, and this essentially is going to break open the doors to all the other questions that you've asked, the protocols, how the machine works, why it works, everything. Okay, if at the end of this, what do I tell people? If after the end of this you have a bunch of protocol questions still, you say, hey, okay, now does it work on this? Okay, now well, what about this condition? Okay, yeah, well, what about this, Josh? Then I haven't done a good enough job explaining what this does. Okay, so this is where I spend most of the time because it branches to everything. The first thing we know this machine does is it creates atomic excitement. It stimulates the spin of the electron to store the energy inside the cell that lasts for 3 days. You are literally creating or restoring the revolution of the electrons around the atom that equals the amount of energy that is created inside the cell. Okay, it's like a perpetual motion engine that has lost its energy. We come back in and we put the energy back in. So people use the machine. They don't use it every day. They use it every 2 or 3 days because the cells fill up with energy and they go to work. It's plenty of energy, but we don't need to do it so often. We sort of stimulated the energy, stimulated the cell to create the energy. That process lasts a couple days. Okay. The first thing that a patient will report after using your machine after a period of time, and I'm just going to say, in general, the fibro people, okay? And when I say in general, only with our machine, fibromyalgia, chronic fatigue, Epstein-Barr, Guillain-Barré, MS, all the autoimmune diseases, we group into the same category and protocol because it's systemic, and that's how our machine works, okay? All of these people, the first change that they'll see isn't going to be pain relief. It's same with Lyme's, is going to be their energy levels are better. I think I slept better last night because I really felt good all day long. You know, I didn't have like a lag in energy levels. Okay? We're creating more ATP at the cellular level. We've created atomic excitement. We're stimulating the energy growth in their cells. I have an Eastern medicine guy that calls this chi for your chi. Okay? And that's all goes with atomic excitement. Okay? The second thing that we see is the molecules tend to align slightly with each magnetic pulse. This makes the molecules easier to combine, especially when excited. If you've ever looked at things like dark field microscopy of the blood, okay, an unhealthy person, their red blood cells clump and stick together. Okay, our machine, once we sort of re-energize the body and recreate the polarity at the cellular level, instead of sticking or together, they repel each other. Right. Now, conversely, the ones that need to combine, the ones that need to flow into the cell, into the body, become more transient or solvent, and they're able to flow through the body better. The water in the body becomes wetter. Okay. The third thing that we see, and this is very significant for a couple things that you mentioned, but we'll talk about a step later, is the pH of the water inside of the body will become more alkaline of the person or the bottle that you treat. This is measurable. It's repeatable. I encourage you to go to Petco or one of the fish supply stores and just get the over-the-counter litmus paper. So patients that, let's just say patients that their pH is low because of the unhealthy state they're in, you are going to be able to measure and track the changes of the machine over a period of time. Okay? In Australia, 3rd and 4th stage cancer patients that come in with a 7.2 pH, they'll do 2 weeks worth of sessions on them, and then their pH will be up to 8.0. Okay? Obviously, they're doing other things with the diet and nutrition and all of that, but the machine creates a significant shift, and we're about to talk why it does, as opposed to, if you read the advertising for things like some of the water generators that say it's alkaline water, well, how does it work? They don't really know how it works. They just tell you it's alkaline. We're going to talk about here in a second how it's actually working inside of the body. Okay, we can't change the alkalinity of the blood. It's pretty much set, but we can change the alkalinity of the water, and because we are mostly water, it's pretty significant. Okay, so when I tell people, yeah, the alkalinity shifts of the water inside of you, that's why cancer patients get results, and that's why a chronic knee injury gets results, they look at me like I'm nuts, but they don't have the background to understand that the increase of alkalinity is going to decrease the inflammation in the knee, and that's why the athlete uses it too. Okay? So like I was saying before, this sort of all connects, and that's why we go through it together. The next thing that we see with the fluids inside of the body is the surface tension of the fluid will reduce or shift on the order of about 16-fold. It means the fluids, or like I said before, the water becomes wetter, but also it flows into the cellular gates more efficiently. The lymphs loosen and they'll thin and flow. When we treat people with a stuffy nose or congestion, when we treat people with lymphatic drainage, that need lymphatic drainage, we'll treat their feet, we'll treat their hips, we'll treat their armpits, and they will get the drainage within 24 hours. It's pretty dramatic. I did a test for a pro football team that didn't believe when we said the water gets wetter. So what we did is this. We took 2 bottles of, Costco water. You buy the 35-pack of Crystal Guys or whatever it is. We pulsed one for 15 minutes. We didn't pulse the other, and we let them sit overnight. And the next day, we took them, we opened them up, and we poured them into brown paper lunch sacks. Okay, and I looked like a goofball standing there with 2 brown lunch sacks full of water. But what happened is the pulsed water beads through the bag, and the bag bursts much faster than the non-pulsed water. I mean, significantly. So we're able to see that it is absorbing and passing through the molecules of the brown paper bag faster, more efficiently. So it translates to the water is going to flow into deeper parts of the body that's needed. It's going to get there faster. It's going to get there more efficiently. And in some cases, which we're going to see, it's going to get there in times where it's not gotten there in a long time, and that's going to address your patient that you mentioned earlier that felt wiped out. Why did I feel wiped out? We're going to talk about that. Part of it is connected to the water becoming wetter. Okay. I mentioned it connected before, but the red blood cells separate, and the reason being is they actually restore their negative charge. And when I say their negative charge, if you get 2 magnets off your refrigerator and you have a negative side and a negative side, what happens when you try to push them together?
There we go.
Nothing, right? You push, and even big old Shaquille O'Neal, I've seen him. He pushes those magnets; they don't click. Okay, that's how we want our cells to be. We want them to all have the same polarity, the same charge, so that they repel each other. And after a session, they're getting their own oxygen, their own nutrition, their own solvent into the cell. It's essentially I equate it to you can breathe and eat and sleep much easier when you don't have 20 people standing on you, and that's essentially what we're doing. Next thing that we see, and you're going to see this consistently, and so much so that we're going to give you a little bit of a caution, is the vascular system relaxes. We found this out by complete accident when we did clinical trials in the turn of the last century, which sounds so funny to say, but 2000 and 2001. Part of the clinical trial requirement is we had to do before and after blood pressure for everybody. And we found this pattern over 2 years that people with chronic high blood pressure, it was reducing their blood pressure over time. where we would give them, let's say after 2 months worth of sessions, they would come in and their pre-blood pressure had changed and had balanced, and they weren't on meds. They obviously, because that was an exclusionary factor for the trial, we found as a byproduct. So we've taken it to the next step here, and you're going to see that most patients, after a 20-minute session, you're going to get a change. If you have somebody like my grandmother, okay, my grandmother is 99 and she's 96 pounds. If I give her a 30-minute treatment, it's going to drop her blood pressure so much that if she stands up right out of the chair, she's going to go, oh, Dr. Herb, and look like she's going to pass out. She's going to get a little bit woozy because her blood pressure is going to be low. So tying into where you asked about contraindications, it's not a contraindication, but I always recommend have a packet of saltine crackers or table salt or something like that around in the office on the off chance that every once in a while you get somebody woozy. Because the second that within 15, 20 seconds of giving them the salt crackers or a little bit of salt, it brings their blood pressure up and it balances them. They feel better. Okay? And that's just as an FYI to point out. We also see a fantastic result with migraines. Chronic migraine sufferers, their migraines go away over a period of time, and they'll see it because of the frequency, the intensity, things like that, and part of it is the vascular system. We're training the vascular system to relax in times of blood pressure buildup, and so over time, their migraines decrease. You are speaking to somebody whose life has changed because of this. I used to have terrible migraines in college where migraine sufferers, it's not how long, it's how many days you're out, and mine was 2 days under the covers because I just needed darkness. And now, after all of these years and just using the machine, the worst thing that ever happens to me is I get a little bit of a stargazer in one eye. No headache, no going under the covers, no nothing, only a smile like, wow, this is so cool, and all I get is this now. So it's been dramatic for me, and I've seen it with lots of people. Okay? The next thing that you're going to see is a systemic response to the sessions. Many times you're going to have patients will tell you that their functions have been fine-tuned. I don't feel any pain relief in my shoulder, but boy, I was smart as a whip last night, or things like that. And in other cases, they're going to tell you that the targeted problem you've been working on hasn't gotten any better, but another problem that you never even knew about or never even worked on got better. Just a quick example, I see this so much in professional baseball. We get baseball pitchers with a sore arm during the season. I will treat their sore arm, and in 5 or 6 sessions, they'll tell me it's not any better. And I'll say, you mean to tell me you don't feel 1% better from this machine? And they'll say, well, no, actually, my bad knee that I didn't tell you about from the last 5 years, it hasn't felt this good in forever. But my shoulder, it hasn't helped at all. And I've never even treated the knee. And that is just because, as you know, the body will prioritize healings, and sometimes we're targeting the shoulder, but it's the knee that gets better, things like that. This happens, so just be aware of it. Okay? The last two points. Yeah, go ahead.
So, my youngest one is a pitcher. He's always complaining of something.
Yeah. Hey, how I hurt my foot is I ripped a double down the line on Sunday, and our batter's box is dug out, and I stepped funny coming out of the batter's box. So I'm happy to help with any sort of baseball stuff with your son. I use this religiously with baseball players because it's, as you know, baseball is a marathon, and the goal is keeping the body as healthy as possible.
Right.
Recovery time for a fracture can be 1/3 the normal time or more. The science and all the clinical trials dictate 1/3, so that's what I stick with. Anecdotally, personally, with pro athletes, with semi-pro, with college athletes, things that I've seen with my own 2 eyes, I've seen 50% return from fracture. And that's because in the clinical trials, they bring somebody in a set thing, right? They have 10 people with a fracture. They treat them 3 times a week at this interval. But sometimes we have a fracture on a pro baseball player that can use the machine every single day. So that also dictates it. So bone stem, bone regeneration, anything related to the bone, it is fantastic with. The results are pretty quick. You can pulse right over a cast. There's no need or worry about any sort of creating any negative damage. It's only going to be positive. Okay, the second to last thing on these attributes, and then we'll shift gears. We'll talk a little bit differently. Is the single most important thing that this machine does, in my personal opinion. If I could only narrow down one function that this machine does that nothing else does, this is the sort of McDonald's secret sauce. This is something called electroporation or electroporosis. Okay, and this is going to address several of the questions that you brought up, but also some of the protocols as well. When you use this machine, we get a very unique effect, okay? We stimulate this, when you pulse the body for about 2 to 3 hours after a treatment, the cell gates are stimulated and they are open and wide open, all of them in the area that you've treated. So if you give somebody a 20, 30-minute systemic session, right? I came in for a bad back, and when we talk protocols, we've done 20, 30 minutes over the entire body. Their cell gates are going to look like this picture right here in the middle, okay? And that picture right there in the middle is very much like a good quality tea biscuit in England. And the reason I bring it up is this. The good quality tea biscuits are designed to do one thing. They're designed to dunk in the tea and absorb the liquid without damaging the integrity of the cracker, right? A good tea biscuit or a cookie is you dunk it in the tea or the hot chocolate, you take a bite, it's crunchy on the outside and soft on the inside. We are doing this to the cells, essentially. They are becoming sponges. They are soaking up all of the water inside of the body, all of the pits, the pores, the gates, that in some cases, because of extreme illness, fibromyalgia, a car accident 10 years ago, mobile for 3 years, still on painkillers, where they're going to be highly toxic. They haven't had water into those particular cell gates in years to dissolve the toxins and actually get them out. With this machine, they will. Okay? And if they don't have enough water in their body, the next day or next couple days after a treatment, they can feel one of a couple things. They could feel flu-like or achy. They could feel sore. They could feel muscular tightness like, wow, I had a really good workout. Okay? Typically, it is the healthier person feels the muscle pain and soreness like a workout. The unhealthier person feels the achiness or flu-like because of the toxins we've just brought out. So every single person that uses the machine, it doesn't matter if it is a pro athlete or, I can't think of, an unhealthy, out-of-shape person. Everybody needs to drink water because scientifically we're using the water with this machine to go into the cells. And if we don't have extra water to then flush it out, they may experience what your patient felt. Flu-like, achy, sore, a little bit yucky. Okay, we've brought toxins out of the body or out of the cell, but we haven't flushed them out of the system. So that is a critical step. Okay, on the other end, okay, right now they're doing a clinical trial in San Diego, California at Scripps Hospital called electroporation in head and neck cancers. And what they're doing is they're using a clinical PEMF machine like ours, but built into a wall in some lab, right? And they're pulsating tumors, and then once they've electroporated them so the cells are open, they're injecting a measurable amounts of chemotherapy with the goal being to combine Western and Eastern medicine. They're trying to kill the tumor without killing the entire body. And so why I bring that up is because if you are doing anything with a patient that involves naturopathic, homeopathic, anything that they're doing, oxygen, nutrition, any other adjunct to your therapy, it's going to go into the cells 20 to 30% more. It's going to be driven into the cells more. They're going to feel the effects more. They're going to get a better uptake and a better result. Okay, and conversely, it's not a contraindication, but what we watch out for are patients that are on pain pills. Because if you have a patient, as an example, Ted comes in and he's had a back injury for 5 years. We're trying to get him off pain meds, but he's down to 2 a day, and he said, I've been down to 2 a day for the last 6 months, right? Just as an example. When we put him on the machine, Ted's going to feel those pain pills more than he has usually because we're driving it into the cells. Okay, it's just as a byproduct. And I bring it up because just so you're aware of it. So the electroporation thing is a fantastic thing for us, especially when we're working with autoimmune, because we are able to get into the cells in places and times that we've not been able to. Lyme's patients, their treatment protocol is much less time. It's much slower, right? Because as you can imagine, if we do a full-blown, we put a real severe Lyme's case and we say, all right, you're coming in 4 times a week, 30 minutes. They're not going to be your friend after a couple of days. Their face or wherever the problem is, it's going to feel like it's on fire. They have short sessions because we're rebuilding the immune system. It's taking time. Okay, the last attribute here, and then we're going to stop for a second just to go to some questions and then shift to the protocols, is this is what we find scientifically. When I mentioned about the alkalinity, when I sort of have loosely talked about cancer and things like that, we know scientifically that the cell can change some of the sodium back to potassium. We are literally creating a biological transmutation in the cell at a much faster and accelerated rate than normal. One of the processes of our body getting rid of inflammation is the conversion of sodium to potassium to then pass it out in our waste. Okay? It takes a very, very long time. This machine will do it, I don't want to say instantaneously, but overnight. A patient with 3 or 4 centimeters swelling on the knee, you'll give them a 30-minute treatment on the knee, and then the next morning they'll call you up and say, was that voodoo that you did? Because all the swelling is gone. How can it be that all the swelling is gone? That's not right. It seems weird. Okay, and it is only because we are accelerating a natural process that's found in the body. The byproduct, this happens, natural byproduct of the conversion of sodium to potassium is an increase of oxygen. Oxygen and potassium are married together in the same way that sodium is sort of the antioxidant. Okay, the more sodium that you have in the body, the less oxygen that can be produced. Tying into just what you mentioned about cancer earlier, we know that cancer doesn't like a few things. We also know it likes a few things. Cancer loves a low-energy host. Cancer loves sodium, and it hates oxygen. Okay, we know those things. So if what we're doing is doing some of these things, now we're talking about putting the body in a state to sort of give it the tools to fight the fight. Okay? And the last thing is the electromagnetic pulse is causing the person to generate tiny little microcurrents throughout their body. You feel the pulse jump a gap where if you put it over somebody's fracture, they'll tell you, that is so weird, I feel this ticking right where the fracture is. We are creating a very small micro arc from one point to the other. And even though we are doing this, because we are doing this as a pulse, because it's a strong magnetic energy that's pulsed, we can do it for up to an hour or two without adverse reactions, without damaging the body, without hurting the cell. This picture at the bottom is a good example. If you put your hand on top of the candle, you're going to burn your hand, but if you move your finger in and out of the flame at the right speed, you'll never create heat. You will only transfer energy from the candle to your finger. You won't get burned. And that is a similar concept with our machine. It's high energy, but it's a very fast pulse. Okay, and so those are the known scientific attributes of the machine. There's lots of other positives and benefits that happen because of that. But again, because I try to stick in the known clinical, that's what I address or I cover. We're going to take that and the next step go into how we use the machine and the protocols. But before we do that, I want to stop for a beat. I want to see if you have any questions, anything about what we just talked about that we can address.
Nope, I kind of digested that pretty well. Yeah, a lot of the issues I've had here for years, particularly with the opioids and stuff like that, I've had patients come in off the street and find out that you can't write a script and they're running down the road. And the sort of people I really don't want. But there are other people who don't want to be on that stuff, and I want to be able to, this I'm hoping is the answer, to deliver them what they need. The question is, can we deliver it on a cost-effective basis that's affordable to these folks? I'm not living in Beverly Hills here. You know, I'm in a fairly well-depressed area that's just trying to make a comeback out of the doldrums that have been in our area for the last 25, 30 years. So there's not a lot of people with a lot of this cash. But I still want to be able to do what I have to do and make a living. Put it that way.
Which is, I mean, you're in the right spot, and I think also just philosophically, you're approaching it from the right angle as well. I think the demo, the 5-minute demo, I think is going to be critical for you guys because how do you tell somebody all of these things about this machine before they've ever even tried it? It's so impossible. That is why, and we'll go over it a little bit later, the most important way that you market this machine, at least that we suggest, that we've seen the most success over the years, is every single person that walks in that front door, we let them know, hey, Mary, hey, Fred, guess what? We have a new technology in the office. We think you're a candidate. We want to bring you back and do a 5-minute demo. Okay, and since we're talking about it, I'm just going to dive right into it because I have a 1-page document. Okay, the art of the 5-minute demo is so critical, and it sounds funny, we made a stick figure drawing because it is the single biggest form of success we've seen. I've had practitioners spend $40,000 or $50,000 doing like a TV, radio ad campaign and got no business, and then they do this and they have a line out the door. Okay, you bring Mary and you bring Fred into the room, and it doesn't have to be you. It can be a technician, whoever you've designated to operate the machine. And you let them know, hey, we're trying out a new technology in the office. We think you're a good candidate on it. We want to give you a complimentary session and see if it helps. Great. So we we, and when I say we, you or the operator, the technician, you know your patients and you're going to know their chief complaint. It may be, and you sort of alluded to with one guy, sometimes you have people that come in with everything. I've got a neck, a back, a shoulder, and you fix the shoulder and now there's something else. They've always got something. What you want to do is target the chief complaint, the main problem, the big reason that they've been coming to you. We bring him in the back room. We do a 5 minutes, up to 5 minutes only, no more than that, 5-minute demo on their one bad spot. And I'll give you 2 examples. Mary has a rotator injury on her right shoulder. Fred has a low back problem. We're going to turn the machine on. We're going to put the loop on the shoulder problem to where the patient says, okay, yeah, I feel it. Wow, right in my spot. We're going to do 5 minutes, and that's it. Same with the low back. We're going to bring it into their spot till they feel it, and they say, wow, that's right, I feel it right on my bad spot. And we do 5 minutes, and that's it. I can promise you in 5 minutes there's going to be some sort of change. It may not be that rotator cuff pain 10 goes down to a 1, but it may go to a 7. And in 5 minutes, that's pretty mind-blowing. So at that point, we've done a 5-minute demo where they felt the result and they feel better already. Then it's very easy to say, wow, that's great, it works for you. Let me tell you how we offer the service. A la carte session is, I'm just throwing out numbers just for the dialogue, a la carte session is $40 per session. A 5-pack is $35 per session, and a 10-pack is $30 a session. Typically, at that point, it's easier for the patient to make a financial commitment because they felt the result and they know it's going to help them. But the big benefit on the practitioner end is once they've bought that 5-pack or that 10-pack, now we're going to get the commitment that they're going to come back and use the machine, and we know they're going to get the results. And once they get the results, they're going to tell everybody. And the word of mouth spreads. And just doing this little 5-minute demo and everybody keeping the machine busy, I can't even explain how effective it is. It's been the single best marketing thing that we've seen over all of these years. And that's completely not a protocol. That's not how you treat people in terms of a treatment. That is just the demo. That is just, if you will, the art of a 5-minute demo. Does that make sense?
This would be similar to a technique I've used over the years was using my massage therapist and the same sort of thing. I get them in for a free half-hour massage or something like that and work them in this way. So basically, I'm substituting the massage for a 5-minute demo on this thing. And so basically, It's just going to take me to get to the front door for the demo.
Yep. You just get, here, some of the suggestions people have done over the years is when they're first starting, they put their machine out in the lobby. So everybody's out there and they see the demo going on. Everybody asks, what is that machine? What are you doing? Or they ask the other person. That is one idea. A sign in the window that says, ask us about free pain relief. That works too. But, I hate to say less is more, but you really don't need to spend a lot. You just need to start with the people that are already coming in your door with the try a sip of the Kool-Aid type of deal. That's what my dad used to say is, oh, you want them to drink the Kool-Aid. But you do. That's really what you do, is you want them to have a sip of the Kool-Aid because we know it's going to really work for them, and people say, gosh, this is great. I would have totally paid for this if I knew that it did this. Well, that's why we do it, because that way you know it's going to help you.
So let me ask you a question. If I did it the way I used to do with the massage, I would take them out and say I would do a street fair. There's a street fair in every town around here. So it cost me $25 for a table for a day. I would actually send my kids out because they are the best salesmen that have ever been trained on the face of the earth.
Absolutely.
Because they did.
Absolutely.
And what I would ask them to do is, if they would get me 100 leads, okay, I would get 50 of them scheduled, and 25 of them would show up, and 12 of them would become patients, which more than already paid the ticket, all the way down,
Yep.
That's what should work on this. Am I correct?
If you don't hit an absolute home run out of the park, I will be stunned. And I'm serious when I say this, especially because you're using your kids. My kids do work at the trade shows and stuff for me also because they have no fear. They'll talk to anybody. They'll do it, right? I get it. I will be stunned if you don't hit it out of the park. Yes, it's great. This is what I recommend. You go out there every once in a while to the community. Yep. With that?
My kids can do anything because of that.
That's awesome. It's awesome. You use it. I mean, I'll tell you. You know what I used to do when I first years ago, before I had my machine, there was a predecessor technology. That's how I got involved. The gentleman passed away and he left the technology to me. But before it was my show, one of my jobs was recruiting clinical trial patients. And you know what we used to do is at the YMCA here in LA, they had a monthly fibromyalgia support group that was packed with people, 150 people plus. We went in there and did that. We said, hey, we've got something, a technology where we want to just come and talk about it and give everybody a free session. The clinic was packed for like 4 months afterwards, just from that group. So any of those things that you can do are absolutely the best way, because as you know, with this machine, there's no way to describe that feeling when you put the loop near somebody's old injury. I don't have pain in my back, but you know what? That's where I had my back surgery 30 years ago. That is crazy that I still feel it there. You can't describe that to anybody. It's not a tangible thing. It's something I have to feel. So going out, that is, you're spot on. That for sure you will do well.
Okay.
Okay, and they don't need protocols or anything like that. All they need to do is ask the person where the problem is and put the machine on their bad spot. The protocols are for when they come in and work with the doctor, when they work with you. Okay? Okay, and that is a good transition into, we're going to talk about, if you will, the basics, the protocol. Okay? Here's the first thing that I want to tell you is as we do this, the protocols for our machine, how we use our machine, is a little bit counterintuitive than other types of therapy. We're not concerned with the name of the problem or the pathology per se. What we're concerned with is where in the body it is and what it's doing. That's what we're concerned with. And I'm just going to give you an example. The protocol for that with this machine for post-stroke, for Parkinson's, for bipolar, for depression, for autism is all the exact same. The protocol for chronic fatigue, for fibromyalgia, and for MS is 95% the same. Okay? The protocol for a torn labrum in the right shoulder, rotator cuff injury, biceps tendonitis, they're all almost the exact same protocol. Okay? And it's because the area of the body. Okay?
That's all great. I got you. No, I hear what you're saying.
Okay. Okay. Okay, cool. So what I'm going to do is I'm going to give you what I'm going to do is when we're done with this call, we send you a document that's the A to Z protocol list. Okay, but if I just send it to you now, there's references in it that wouldn't make sense. So I'm going to give you all the references so that way the document makes sense. We won't spend time going over every single protocol. We're going to give you the tools so that way so everything makes sense. Okay, so the standard protocol for 90% of the issues that you run into, 85 to 90% of the issues, is we do positions 1, 2, and 3 and box the area of need all at 2 to 3 minutes. And we're going to talk about what that means here in a second. That's the general protocol for most things. Okay? So, and we'll also talk about why. So position 1 is going to be for the chest. Okay, we turn the machine on, and we bring the loop towards the chest until the user feels it. We want to have it above the collarbone, targeting the thymus, not below. You will feel a dramatic difference if you put it an inch above or an inch below the collarbone. Okay, and with our machine, an inch is a mile. You're going to find significantly that this will happen. You're going to put it over the back of somebody's right shoulder, and they say, I don't feel anything, doc. And you'll move a half an inch to the right, and they're going to jump out of the chair. Not that you moved it any closer, it's just you moved it to the right and then you got the nerve. So a half an inch goes a mile, and this is a good way to sort of see that when you first use the machine. So we bring it in and we do it over the chest for about 3 minutes. Okay? Position 2 is for the crown of the head. It's for the brain, it's for the pineal. Okay? And we start like a little halo, like an angel. We put it over the crown of the head. We turn the loop on, and we bring it in until about this point that you see here on the screen, where the little white halo is. And typically when it's there, they're going to feel it in their teeth, they're going to feel it in their nose, in their sinuses. If they've had any sort of previous facial injury, I've treated a lot of UFC fighters, and they'll say, oh, this is where I broke my nose in this fighter. This is my fractured eye orbit. That's weird. I feel it right here. They're going to feel it wherever their spots are. The goal is for them to feel it, but without it ever being uncomfortable. Okay?
Yeah, that position is the one where I get the most feedback from people that they feel it in their eyes. I feel it in my eyes.
Yep.
And
I do too. And you know where I feel it is where my dental work is. I feel it in the eyes and my dental work. So it's normal. Now, conversely, okay, your kids, the younger they are, the less they're going to feel it. So my kids pass this up and down their head like it's a hula hoop, and they look at people like, what do you mean this hurts? Okay, they don't feel it the same way we do. It's the darndest thing. Position 3, mid-back. We do the mid-thoracic, okay? And the point being, we're not doing the tailbone. We are not doing the shoulder blades or the atlas. We want it in the mid-thoracic area, so we're really doing the adrenals. We're doing the kidney. You're going to get the backside of the digestive system, the backside of the liver, okay? Most people describe this spot as electrical hiccups. It doesn't hurt. It's not uncomfortable, but it makes my body jump and I can't help it. It's funny. That's generally some of the feedback, okay? We do those 3 positions, whether Joe came in with a broken toe, Mary with a rotator, or Fred with MS. We start with those 3 positions. We are energizing the systems of the body to do the work. The whole theory of PEMF is that the immune system is really the cellular structure working together. So the broken toe doesn't heal the broken toe. It's the systems of the body that accelerate the healing. It makes sense for us to energize them first to then go do the work. Okay? And yeah, absolutely.
Okay, so was my understanding the third position was lower, between the kidneys, just above the sacrum down there. So I should keep this higher then, so I'm covering more ground, is what you're saying.
Yeah, you want the mid-thoracic. Yeah, you don't want it to be, if it's over the low back or towards the sacrum, it's going to feel a little bit achy, and we're going to get there. Okay, we're going to get there, and we'll get that spot. We want, right, exactly. Okay. We have found even trial and error, and I'm going to give you an example. If you do 20 minutes on somebody's bad shoulder, you just put it on their shoulder, push the button, and walk away, it seems to be less effective than doing these positions and then the next part, which we're going to talk about. Okay? So again, I'm not going to force you to paint the painting in our way. I'm just going to give you the paint on the palette and let you, do your masterpiece. But I'm just going to give you as much information as possible. So using our shoulder injury as an example, we've done the positions 1, 2, and 3 that we've seen on here, all at 2 to 3 minutes. And now we want to box the area of need. And boxing the area literally means coming from as many angles or as many walls as possible. 3 walls or 4 walls, right? So for that shoulder injury, it doesn't matter if it's a rotator on the front, if it's supraspinatus on the back, it doesn't matter what it is. We always are going to do the front of the shoulder, and then we're going to do the back of the shoulder. Okay, the patient, regardless of the location of their injury, they're always going to feel it more on the back side of the shoulder because it's closer to the spine. So even though they have this guy here with the muscular swimmer, he may have an injury on the rotator on the front, but that picture where it's treating from the back side, he feels the pulse more, even though we're not over the injury site. Okay, and you'll have that with people too. Okay, we want to then make sure we put their arm through the loop as well. We're boxing the area. We're coming from as many angles of approach as possible. This is why an MRI is cyclical. It's a circle, and we go inside the middle of the MRI field. Similar with our machine, we are trying to get as many angles of approach as possible to get the injury or the problem right in the center of the field. Okay, so when we're talking about boxing an area, that shows how we box a shoulder. This will show you how we box a knee. You got an applicator that is not the big one. You get a smaller one that has Velcro and neoprene. Okay, what this does is it changes the shape of the field to be focused and more right on the area. You get a much better result from a knee injury using this smaller applicator than you do the bigger one. The patient won't feel it in the same way too. Okay, so we just wrap it on their knee at 3 minutes, and we rotate it, and we just keep rotating angles. Okay, and obviously you're going to get all these documents as well via email, so I'm going to send these to you. But same with the Achilles, a calf, any of these smaller, hard-to-reach areas, we use the small applicator that you're seeing here, and we box the area. When we have a larger injury, a groin, a thigh, a fractured femur, any sort of large body group, then we go to the larger coil. Okay? This guy's a hamstring injury, so how do we box the hamstring? We come underneath, we go to the side of the hamstring, we go to the other side, and then we go on top. Okay? The same thing works with a hip problem or a groin problem. We put it right over the hip on the front to anterior. We go posterior to the hip, and we go the leg through the loop and treat the hip socket. But when I was Shaq's personal pulse guy, pulse concierge guy, he had a partially torn hip labrum, so we had to make this big old loop for him that he could pull up to his hip socket. But we were able to treat it. He could feel. I mean, that's a big guy, so that's why I use the example. How do you get 2 feet inside of somebody's body? That's how we were able to get his legs through the loop and get it as close to the hip socket as possible, and we got to the labral tear. Okay, tailbone, same with the hip. That's another way to box the hips is having them sit on the loop. Okay, and again, it's just showing you positions: the front of the hip, the right front of the hip, the left front of the hip. Okay, it's generally boxing an area. So that is the ultimate goal for the majority of the, if you will, injuries. We haven't talked about disease yet, which we're going to, but the injuries, that is generally what we're looking to do is 1, 2, 3 in boxing area. Okay, having said all that, I just want to throw out one little reference point. I always tell you that 10 out of 10 times default to your gut instinct, not the protocols. Okay, because you may have a patient that comes in for a hip problem. They're telling you, it's my right hip, and you treat them on the machine 3 or 4 times, and there's no relief at all. But you've been their practitioner for a long time, and you have a suspicion that it's really their old foot injury on the left side is coming back, and you want to treat their left foot. Do that, because I bet the hip pain is going to go away because you know the patient more than the manual does. Does that make sense?
Yes.
Okay. Just keep that in mind, keep that reference in mind, that your intuition got you to where you are. Okay, we're going to talk about the other part that's not in the manual, and that is autoimmune, systemic, things like that. A lot of the different conditions that you were mentioning that you're running into. How do you treat a systemic disease like fibromyalgia, right? Okay, with fibromyalgia, what we want to do is we're going to bring them along slowly, and we want to get them to commit to coming in and using the machine, because it may be that the first couple sessions, they don't get a result. It took a long time for their body to get into that state. So if they have one 20-minute session, they may not feel a difference. How typically autoimmune people respond is this way, okay? Generally, we have 2 responses to the machine, like a second-hand timer of a clock ticking where they're slowly getting better after each treatment, right? And then we have people that make these weird jumps, okay? And I'm going to also email you a paper. We have a lady that wrote a paper for us called Hang in There, It Worked for Me, and this was the extreme example. She had 30 sessions, three times a week for 10 weeks, no results on the machine at all, nothing. The morning after session 31, she had a hallelujah cure and has been good ever since. Her fibromyalgia was gone. She woke up and it was gone. So she wrote a paper about Hang in There, It Worked for Me, because I didn't think this thing was doing anything until session number 31, and it did everything. We have people that will respond this way, okay? You'll have fibromyalgia Mary that has the first 5 sessions has no results, and then the morning after the 6th session, she has a big jump, and 15 or 20% of it is gone, right? Or let's just say generally she's 15 to 20% better. She makes a big jump, and that holds. And then she has her next 5 or 6 sessions, and there's no change. She's still that 15, 20% better, but no change. And then the morning after session number 13, boom, it's another 15% change. Okay, they change a little bit differently, and so that's why the consistency is key with the machine. And here is why scientifically. This is what it all boils down to. How the machine works really on a cellular level is this way. Every cell has a program or a coding of DNA inside the cell that's already there, right? We can't do anything about it. It's already set. The liver cells say do this. The brain cells say do this, okay? This machine puts energy in the cell, and when it's full of energy, it reads the DNA coding and stops doing stuff it shouldn't be doing and only does the stuff it should be doing. It goes back to performing its regular or normal cell function. When it does that, it takes time then to do the work. Okay, so fibromyalgia patient, we need to give them 12 sessions in a month, 3 times a week for 4 weeks, so those cells are full of energy, they're reading the DNA code, they're going to work, and they're staying healthy and active, so that way we can get a jump in health. Okay, that jumps into the big question, if you will, which is cancer. Okay, cancer is for as you know, politically, there's a million dangerous reasons why we stay away from it, but scientifically, there's lots of things that we think that we can do to help. Okay, so with our machine, the first thing that you need to do with the patient is if they have an active cancer and they want to use the machine, you need to sit down and consult with them and just explain a few things about the machine, and most importantly, that you need a commitment from them, that they can't just periodically do it. They either need to commit to do it or not do it, because periodic does not help it at all. And I'm about to tell you why scientifically, okay? The protocol for almost all cancers that they use in all these clinics in Europe and Australia and other places is the opposite of what we've just talked about. It's totally different, okay? What they do is they are treating just the tumor or the known areas of cancer 3 to 4 times per day, but in short sessions, 7 to 10 minutes. Okay, so I'm going to give you a hypothetical example of somebody I knew in Australia using the machine. They had a third-stage pancreatic cancer. It was fairly aggressive. They know that the cellular division was occurring within every 8 to 12 hours. So they used the machine 3 times a day, 7 days a week, no breaks, until they went back to the doctor, and the doctor said, "We made a mistake. That must not have been cancer." Because when you are with cancer, the goal is, and obviously these are the aggressive cancers, the goal is, and why they use it, is to keep the cells full of energy, so therefore it won't divide. It ceases to say, wait a minute, I'm an aberrant liver cell that can only do one function, which is replicate itself. I'm supposed to be doing this function. I'm supposed to be doing that function. So the reason that we have even put in the manual about the cautions about cancer is a lot of the times people just want to try it for a little bit. Well, let me try it for a couple days, or let me try it for a month. And if it doesn't work, they think, oh, the machine could make me worse. Or the machine, right? We live in a funny world. So we tell people, you know, we're very upfront with what it is, and have you be upfront with the patient if they decide to use it, so they know that if they're going to be using it, they need to make a commitment to you to come and use it, because that's how it works, and it will only work that way. It'll only work when we're doing it on a consistent basis. Okay, a slower moving cancer, a non-aggressive cancer, and I'll give you one more example, a slow-moving breast cancer, right? Because they're very, very slow-moving breast cancers, in contrast to an aggressive brain cancer or an aggressive pancreatic cancer. Those ones, we do 3 times a week, and we use the normal protocol. Okay, the slow-moving ones, we use the normal protocol we discussed. The aggressive cancers are a totally different ballgame that we approach very lightly. Does that make sense scientifically?
Yes.
Okay. What questions can I answer for you at this point about things that we have covered or not covered? Let me hear what answers that I can give.
I'm pretty much right with you there. I just need to get in and do. You know what I'm saying? That's where I get my questions.
Awesome.
So right now you're tickling the mind here.
Oh.
Thinking about what. You guys have any
questions? Can I get you to write down one thing? Can I get you to write down one thing? I forgot to do this at the beginning. I just want to give you my cell phone number, because that way if you ever have any questions and you need somebody to reach me or text me or something, hey, we've got a patient with this, that way you have my mobile number and you can access me directly. And if I don't have the answer, I will get you in connection with a practitioner that does. But I just want to give it to you so you have it.
Go ahead.
It's area code 805-341-4902. And the last question that you asked that we didn't address in the lecture, in the conversation, was that contraindicated, it's pacemakers and other electrical implants. That's a scientific reason. Politically, it's contraindicated for under the age of 18 without written consent and pregnancy. Okay, it's contraindicated for pregnancy because we live in a world that everybody likes to sue. I have a 5-year-old and a 7-year-old that have literally been using the machine since the moment the stick changed color and we found out we were pregnant, if you will. My kids work at the trade show and use the machine, and like how you were just talking about, my 5-year-old runs down the hall and grabs somebody in and uses the machine on them and treats himself. It is only for political reasons that it's contraindicated for those two. So just make sure you have written consent if you're gonna approach either of those 2 areas.
Okay.
Yeah, and I'm happy to do this again when it makes sense. I'm happy to answer any questions and provide anything that we can going forward. I think what you'll find is there's a lot of questions you don't have yet. It's what you said. It's once you get doing and start using the machine, that's when you'll start to develop more questions, and we can sort of go to the next step then.
Okay. So, Lyme disease, that would be covered underneath the same thing as fibromyalgia and all that sort of stuff?
Yep, it's all going to be in this thing that I'm going to send to you. But essentially, because that was one thing, just to have a little dialogue with all of these diseases. What we're looking at is a systemic problem. So fibromyalgia, we do one of 2 things. We'll treat we'll do positions 1, 2, and 3, and then box the main areas of pain, typically the shoulders or the hands or the feet. With fibromyalgia, the other thing that we use is the blanket, okay? And this is the other point. With the autoimmunes, because you're essentially rebuilding an immune system, we don't know where it is. Sometimes it's better to just use the pulse blanket as opposed to the loop, because I don't know if you've tried the blanket yet, but the blanket is more tap, tap, tap over the entire body instead of thump, thump on one spot. Okay, so